Sleep, we've talked about this. So the mechanical control, the biochemical control, all of these things that help your extracellular matrix work right, create those different zones, the pericellular matrix, the territorial matrix, the interterritorial matrix, help it lay down the collagen fibrils either in a parallel, crumpled up, or pillar type arrangement, help them cross-link properly. All of this happens at night, okay, while you're asleep. 7 to 9 hours is the recommendation for most human beings on this planet. And then the circadian rhythm matters. I call it a constant routine protocol. You need to go to bed more or less the same time every day, wake up more or less the same time every day, weekends and holidays included. Anytime you disrupt this, you're effectively putting your body into jet lag and everything falls apart and doesn't work right. So you need to get a consistent routine, and that routine and structure is going to train your body and train all of the clock genes, when to work, how to work, and it's going to let them work. Being just all over the place is really linked to prevalence of osteoarthritis and other musculoskeletal problems. For instance, shift workers have a much higher incidence of osteoarthritis, cancer, other problems relative to people that don't work shifts. Why? Because their circadian rhythm has just been destroyed. So the circadian rhythm matters a ton. And then even more importantly, if you can match your gut feeding fasting clock to the brain's suprachiasmatic nucleus, which is what responds to UV rays from the sun, match the two, and then you're really in a good position to help yourself out. So you got to practice good sleep hygiene. Try to get on a schedule where you're not eating at night so you can enter into a fasted state, because that's when your body's repair capacity works the best. All right. So the circadian rhythm will influence the activity of your chondrocytes. So whether or not they're metabolically active, are they sending out signals to produce proteins? Are they making proteins? Are they repairing themselves? Are they telling the extracellular matrix what to do? It is important for the synthesis and degradation of the different components of cartilage that we talked about, the proteoglycans, the aggrecans, the perlicans, the collagens, okay? It turns on or turns off certain genes as needed. For instance, you might upregulate the NFKB gene, which is highly inflammatory, or you might rather upregulate the NRF gene, which is highly anti-inflammatory. And then you've got hormone oscillators. So cortisol linked with stress and being awake, highly inflammatory, okay? This is why you want to manage your cortisol. And then melatonin linked with sleep is extremely antioxidant. In fact, melatonin is one of the most antioxidant molecules we know about. And again, not to, beat a dead horse, no offense to the horse rider of before, irregular sleep patterns will affect that repair and regeneration of your cartilage, and it will exacerbate so-called pain. What is pain again? It's just an electrical signal from a nerve ending to the brain that gets modified all along the way, modified by your brain, and you either perceive it as pain or not. So if you can decrease those inflammatory signals or those mechanical signals that initiate and then control the modification up and down, you're gonna have less pain in your joints. You're gonna feel better, you're gonna have a better quality of life. So it's very important to get on a good sleep schedule if you want the capacity to self-repair.